So in this chapter, which we are going to talk about atrial rhythm, we have to direct our attention regarding P wave. Why? Because the word atrial means P wave character. So this P wave normally should come from the SA node, as we know. But sometimes the SA node fail to generate the impulse. And we have another excited cells within the atrium, like we call internodal pathway, may initiate the impulse. So this means what? I will get abnormal P wave behavior. And we are familiar for much time that what is the abnormality if we detect issue regarding the P wave. So we call this what we call atrial dysrhythmias. Atrial dysrhythmias. And as you know, our wonderful book is going to refresh your knowledge about the conductive system pathway, and it is like repeating itself. And we have here the pathway, how it's going, and after that it reminds us about what is the firing rate for each item. And let us go with this point. What this point? We have the word wandering. What is wandering? If I ask you, Lewis, like, for example, Lewis, I will say that I am teaching you, Lewis, that the normal heart rate range between 60 up to 100 beats per minute. You are right? Okay. And like I was absent today, and another instructor take place of my lecture and telling you, no, the heart rate normally should range between 70 up to 110. So you get like two information. One from your direct instructor, which is me, which is saying 60 up to 100 beats per minute. And the other instructor teach you something which is not accepted, which is 70 up to 100. So what you are going, you will be wondering, right? You will be wondering which one you have to follow. Are you going to follow me or you follow another instructor? This is the same story which happened within our heart. If the SA node is like missing or failed to produce impulse, like I am absent, for example, today, and the other instructor will take the job. So remember, the pacemaker is the SA node in all cases, but this is the situation that it is not giving impulse, but it is still present and still having the opportunity. Like if I am absent one day, but I am still your instructor. I hope this example is clear. So what is the word? I told you that we have keyword. What is the keyword for this chapter? P waves vary according to the site of origin. You have to save it. So this is our keyword for this chapter. Size and shape of the P wave vary. Highlight this word, vary. The P wave may appear upright, inverted, or absent from the EKG. Clear? So this is why we say it is vary. You got it? If you have this information, Zahra, you will be like very easy to analyze any strip. So what is the keyword again for our chapter today? Is P wave is vary. Okay? Vary. Then, so far the P wave vary. So we have another important issue, which is the PR interval also will be vary. So far P, like if I say that P wave is absent, so can I get PR interval? Of course not. Make sense? So this is what we need to know, Irene. According to the variation of P wave, the PR interval also will be vary because the P wave is not as regular. So what is the golden slides tell us that everything is okay, like the standard one, but we have different changes. Like what? The regularity is slightly irregular. Slightly irregular. Why? Because we don't have the same distance between R and R. And what is the PR interval? The PR interval is also variable depending on the site of the P wave show up. Okay? Let us get familiar about this one. And I see, what can you tell from this? I know you have to go by the 5 steps, but we don't need like to waste the time to go over, but you have this experience and you are familiar that you have to go follow the 5 steps. But if I ask you right now, guys, what do you notice regarding we have this chapter? I will highlight for you and please share with me. What this wave?
P wave.
Raise your voice, please.
It's the P wave.
Very good. So all these arrows represent P wave. You agree?
Yes.
Okay. What next? Do we have P wave here? It is absent. Yeah, it is absent, correct, Zara. So here it is absent. Here it is also looks like not the same. It is very fine, but it is not like this one, you see? So the shape is changing. Here also the shape is changing, not like this one, if you compare this one and this one. So you notice, CD, that the P wave is not the same. It has a change in the shape, which is character of P wave changed, vary from the normal. So we call this is atrial. This is atrial. Let us have another example. It will guide us also. If we have this variation coming from the SA node, if we have like this happen for the higher heart rate, which is 100 beats per minute or greater, so this means it is very important and it will lead to a very serious condition, which we call atrial fibrillation, or we have abbreviation to be AF. When you go to the clinic or you work in cardiology department, they will tell you that it is AF. What is AF? It is atrial fibrillation. And this atrial fibrillation is very serious condition, and this will be our first case regarding cardiology. We have to assessment. So pay attention, Lewis. All what we mentioned before till we reach to the point of atrial fibrillation, all the previous cases we say that we are not worried about, no assessment, just assurance, and so on. So, but here, once we get a case of fibrillation, which means the heart rate above 100 with abnormal atrial contraction. In this condition, Al-Hajja, we have to give anticoagulant. And the exam will ask you about what is the anticoagulant. And the other word for anticoagulant is blood thinner. Okay? So blood thinner is the same as anticoagulant. And this for what? To make the blood not going to clot. So we are afraid from a case of AF, if this happen, it will produce multiple clots, and these multiple clots may go travel to the eye, go travel to the brain, go travel to any part of the heart, lungs, and make like thrombus formation. So please put in your mind, this is our first case regarding cardiology or EKG that we have to give assessment. Okay, let us go here and let us pay attention. So please pay attention. Don't write, don't be busy with anything. And let us look together for the following. It is very important for everyone to get familiar about what I'm talking. Okay. Open your mic if you don't have background noise and share with me. What this wave?
P wave.
P wave.
Very good. And this one?
T wave.
T wave, correct. Thank you. So this is P wave, like we mentioned. What this one?
P.
P wave, but it is
Inverted.
very good, correct. It is inverted. So we have one up and one down. And here,
Another up P wave.
okay, would you please, Zara, raise your voice?
It's another P wave.
It is another P wave. What do you think? This one, this P wave looks like this one? Yes. Okay. What about this? It looks also like the previous one. Let us look for this one. This is P wave. You agree?
Yeah.
This P wave, so like this one? No.
No,
This one looks like this one?
No. Small.
No.
They are different in shape, right?
Yes.
They are not the same. Here we have another P wave. You see the small one? It is also another shape. You agree?
Yeah.
And we find that another one with different shape. And you see that here and here and here and here, all the P waves are varies. All of them are varies. And at the same time, they have what we call coming from different sides. And we call this is what? Multifocal. Multi means many, focal means focus point or the point of origin. So this is multifocal. Why? Because we have different shape of P wave. If we have the same shape of the P wave, it will be unifocal. But if it is in different shapes, like we have here, one is positive, one is negative, and one is like tall, one is like short, it is variable in size and shape, and this is guide us toward atrial. And so far, we don't have all the shapes in the strip. We call it is multifocal. It comes from different parts of the atrium. Any question regarding this strip? Any question?
How about
Alright.
teacher? How
Yes.
about QRS2 is here is not like normal,
It
abnormal.
is, yes. So far, we are like focusing on during our study. Sometimes we get something like not pure. So, but for this one, the QRS is normal. You are right.
Yeah.
Let us have something which is new. If I ask you, ladies and gentlemen, what do you mean by premature baby?
The baby born before like 9 months.
Very good. So the baby born before the exact or due time, right? So this is like premature. Also here, if we consider that every 5 seconds, for example, just example, every 5 seconds, we get heartbeat, which is not actually the situation, but it is just example to make the idea. If we have every 5 seconds, 1 beat, and I got like between this one, I got like 3 seconds, I got a beat. So I expect that should be 5 seconds, but I notice one of them come at 3 seconds. So this one we call it is premature beat. Like what? We have like a party and Mark invited all of us to be like in his party at 6 p.m. And I arrived 5 or 4:30 p.m. So I am arriving before the time. So Mark will consider me that my arrival is like premature. I'm coming early than what is there, okay? So we have here the premature. We understand what we mean by the word premature. And we know that atrial, so it has a character of atrial. And again, I remind you, Emily, make your camera on, Emily, that you have to make the atrial that we have a variable P wave. So this is like the variation, which is, we are going to face it 3 times during our study, the word premature. And we have premature atrial contractions, and we will get another one, premature junctional contraction, and we will get the third one, premature ventricular contraction. So we have 3 cases. Put in your mind as a notification that we will get 3 cases during our study talking about premature. Premature atrial, premature junctional, premature ventricular, okay? So what is the point we need to know about premature? Let us see the golden slides, that everything looks like normal regarding the rate. And sometimes we have the changes, which is different shape and size and location of normal P wave. So this means you can put next to it, that is to say, atrial. And the PR interval also will be variable. And as you know, like you mentioned, Al-Hajj, that QRS is within normal values. So let us look for this slide. Of course, Emily, we are going to talk about the 5 steps. I'm not repeating myself, but what we notice here, which one is, sorry, if I look to this strip, you notice something abnormal? I can't hear you, Emily.
Oh, sorry. The length is like not the same in the middle.
So what you notice? I need your notice. We need professional talk.
Sorry. I forgot what that wave was. The one that spikes up.
You forget the name of the wave?
Premature.
No,
I
wait.
didn't-
Emily, talk to me. You forget the wave name?
Yeah, the one that
So how
I think it's the
many
R
thousand
wave.
times we mentioned the name of the wave? And now you are not capable to remember the name of the wave?
I have it in my notes.
Okay, Mark, can you go for this strip?
Yeah, so like the first three P waves look normal. And then when it gets to the fourth and fifth P wave, they're premature.
So you mentioned that the first three, this 1, 2, 3, right?
Yeah.
So this is abnormal?
Normal.
Or no,
No, it
that
is
one is
normal.
also normal.
This is normal.
But then when it
also.
gets to the fifth one,
This
that one's
one, yes,
premature.
correct,
Yeah.
correct. So why this one is abnormal?
Because the distance from the
Premature.
R to R is
Okay, I'm asking Mark. He is talking. Okay, go answer.
the P wave comes sooner than all the
Not the P
ones
wave.
before.
Not the P wave. We don't have P wave here. Right? Here, we don't have P wave. So it is atrial. And it is coming sooner, like you say. So it is premature. You
Okay.
got it? So
Yeah.
you can build the word. It is premature because it comes early. Atrial because I have abnormal P wave. And this is a complex. You got it?
Yeah.
So this is normal. This is normal. This is normal. This is normal. This one is abnormal. And it comes back to normal here and normal here. Okay, Zara, are you following me? Okay.
Okay, I have a quick question. So, go ahead, Luis.
Oh, you can go ahead. Sorry.
So you didn't call it a P wave, you just call it a premature atrial contraction?
Yes.
Okay.
Premature atrial contraction. You have question, Lewis?
Yeah, Dr. Israel. You mentioned for the abnormal one that there was an absent P wave.
Yes.
Okay, so then that's a T wave then before the little spike.
Yes. After that, we got the P wave come back normal.
No, I mean right before the premature atrial contraction, there's the T wave from the previous
This
spike.
one? This one?
No, before.
This one?
Before.
Before what? You said the premature
Okay.
one. This
Right
is the
before
Where
premature.
the premature contraction is.
Right before that, yeah. That the little spike right before the R wave.
This one?
Yeah, is that a T wave from the previous one?
Yes, T wave from this one.
Okay. Yeah, that was my question.
Yes.
Thank you.
Yeah, correct. Sometimes we get the premature atrial contraction comes in pairs. What we mean by pairs? 2 by 2, okay? Yes, pairs. And we have what we call bigeminy. Bi means 2. What is bigeminy, Al-Hajja? We will get one normal followed by one abnormal. We have another situation which is trigeminy. Trigeminy means it is 2 normal followed by the third one is abnormal or premature atrial contraction. So this is question in the exam regarding the bigeminy and trigeminy. So please pay attention for it. Remember, premature atrial complex looks very much like the normal complex of underlying rhythm, which is sinus. Like if we apply this one, if we go here, it looks like normal, but the point which is like guide you, Lewis, is there is absence of P wave and it is coming before the expected time. So we call this is premature, and this will be like very interesting. Let us look for this question which is coming in the exam. If the premature beats occurs more than 6 times per minute, it is termed frequent. So please take highlight of this slide that the word frequent is question in the exam. If it comes more than 6 times per minute, save each word, because in the exam, they trick you about go on with like 5 times or play with the number as a minute or seconds. So be careful, you save it correct and you answer correct. After that, we have more complicated condition, which we call re-entry dysrhythmia. And this re-entry dysrhythmia needs like to be explained for you on person. So I am going, so please, some one of you, please remind me tomorrow when we have our lecture to discuss this issue to make it easy for you. It is not easy to be discussed like such way. But here, I need you to enter into the point, which is the atrial flutter. This atrial flutter is what has a character, and it is very easy strip to be answered in the exam. It has a character of sawtooth. Sawtooth. If you have a sawtooth in your tools, you find that it looks like the same. And what is the number? The number will be like restricted to certain number, but if this number increased, it will be fibrillation. So this is very important item and easy to be answered. What is the difference between flutter and fibrillation? You will answer that the number of the beats are much increased in fibrillation. And as I told you before, with the fibrillation case, we start to get very important medication, which is blood thinner. Here is another point of exam. In the exam, they ask you about gatekeeper. We remember together that I told you that there is 0.05. If you remember, I told you this number is very important. 0.05 seconds between the transmission of impulse from SA node to effective end of ventricle. So this delay is what we call gatekeeper. If the atrium working very fast, the ventricle will not follow this crazy number of atrial contraction. So we will find that maybe we get in this flutter that the heart rate is almost the same, 75 or 80 or whatever, but the ventricle is like less contracting number than the atrial. You find that the atrial may be double or triple the number of contraction. This is why the explanation is that we have a very good guard, which is what we call gatekeeper. So this gatekeeper render the number to be less so the ventricle can work properly. You will ask me, what if this gatekeeper is not there. So the heart or the ventricle will follow the speed of the atrium, and this will be fatal condition. Fatal condition. What do you mean by fatal condition? It will kill the patient if it is not controlled. The atrial flutter, as I told you, may be like more than the ventricular contraction 4 times. And we have here example. Like if we count the number of P's, which is atrial contractions, and we count the number of QRS, we find that the ratio is 4:1. This means what? Like the heart rate, when we count it by the regular technique, radial pulse, I will find that it is 75. I say that's very good. But when I do the EKG, I find that the atrial contracts like 300, but the ventricle is only 72 or 75, sorry. So this means what? There is a very good gatekeeper not transmitting the speed of atrial contraction to be like the ventricular contraction, which is, as I told you, fatal. So the ratio can be 2:1, 3:1, 4:1, it depends, okay? So we mentioned that the atrial flutter with a slow ventricular response, which we call ventricular response less than 60, as you know, that the normal. And we call this is like very important. Why? Sometimes we count the pulse and find that everything is okay with the patient, but actually the EKG will reveal certain abnormality. As you see here, guys, this is very good example of understanding. Look to the bottom, and the bottom strip is for your guide. It is a normal sinus rhythm, but actually it is tachycardia. And if we compare it to the top strip, we will notice the following. If I go here, let us count together the heart rate, 1, 2, 3, 4, 5, 6, 7, 8. So the heart rate here is 80. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So it is like 100. Okay, but what we notice here as a standard, Lewis, this is, let me make the arrows. Would you please, one of you, share with me? Diana, would you please tell me what this wave?
P wave. Sorry, T.
T, very good. And this one?
P wave.
Thank you, good girl. And this one?
R wave. That's the QR.
Very, very good. You catch it, Emily? We
Yeah.
repeated this thousands of times. Okay, so we have here P, QRS, T, P, QRS, T. So this is like just tachycardia. If we consider it is 100, it's okay, normal sinus rhythm. But here, I need one of you, like Johanna, can you go with me? What this wave?
That is the R wave.
Raise your voice, please.
The R wave.
Very good. Thank you, girl. And this one?
Is that the T wave?
Very good. What about this one?
P wave.
Very good. What about this one? Another P wave.
Another
Yes.
P wave.
Trust yourself. Another P wave. Okay. So put in your mind, Erin, that we can get more than one P, but never get more than one T. You got it? We can get more than one P wave, but never get more than one T wave. Okay, CD? So here, if we count how many P's wave, 1, 2, 3, 4. I will make our 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. You got it? 14 P wave. Let us count how many are, like we mentioned, 1, 2, 3, 4, 5, 6, 7, 8. So I have 8 R, which is the ventricle, and I have 140 or 150 or 160, whatever the number of P waves. So this means the number of P waves exceeds the number of QRS, and this is a situation of atrial flutter. And if I find that the ratio is like 2 to 1 or 3 to 1, and actually here we have the ratio which is 2 to 1. What is 2 to 1? Let me delete this one. What we mean by 2 to 1? 1, 2, and we have 1 QRS. And this is repeated many times. 2 P's followed by 1 QRS. So they ask in the exam, what is the ratio? Zahra would say that it is easy, 2 to 1. How do you know, Zahra, that this is 2 to 1? We got like 2 P's followed by 1 QRS. Are you okay, Lewis? Make sense?
Yep.
Very good. Then we go by the serious one, which is the atrial fibrillation. In atrial fibrillation, we will notice absence of P waves, or P waves are going to be replaced by F. F stands for fibrillation. And the ventricular rate is like irregular. And of course, we have a very serious condition, and this condition, we have to get into blood center, as I mentioned earlier. So let us go here by the slides, which I need everyone to save it, is the number here. You see, the atrial contraction is like 350 up to 400 beats per minute. Atrial. What does it mean by atrial? Joanna, it means P wave. And what about ventricle, Diana? Ventricle means QRS. You got it? All right. So let us see here. Look, guys. Oh my goodness. How many P wave? A lot. Let me ask you guys. I know you are smart. So if you remember, I told you what this wave?
P wave.
T wave, correct. And what about this? All of this from here to here.
They're all P waves.
P waves, very good. So remember my advice. 1 T wave. I can get many P wave. Clear? All right. So when we look to these numbers and what is the character of this P wave, actually it does not look like our familiar P wave. So it is irregular, haphazard, and this is why we call it is F wave. Okay, Lewis? So far, I don't have exact, well-known to me P wave, and I got it like this huge number. Let us count. 1, 2, 3, 4, 5, 6, 7. 7 P waves. 7 P waves. If I multiply 1, 2, 3, 4, 5, 6, 7, 8, 9, 9 times 7 equal how much? This is in 6 seconds.
63.
So it will be huge number. It is like exceed 350. So this is case of fibrillation. And please adapt your eye to these slides. This is fibrillation. And if you compare the fibrillation with the one which is for flutter, it will be, so this is for fibrillation. If I go up, look how the difference. So this one has what we call, you see this one, this serration is like the sawtooth. You got it? So you have to adapt your eye for how it looks like. The atrial flutter, this one, which is sawtooth, and the one which is for fibrillation, which is like this. Okay? Any question? So I'm going to stop at this point, and next time we are going to talk about the supraventricular rhythm, which is very easy, and we join the supraventricular rhythm with chapter 9, which is junctional rhythm. So to summarize all what we mentioned for today, I need everyone to get familiar about what we mean by atrial. We have the keyword, which is vary, P wave, vary, may be upright, may be down or negative, it may be absent, okay? And we learned something new, which is the premature atrial complex, that why it is atrial, it has an abnormal shape and size of P wave. Why it is premature? Because it comes before the expected time. Okay, Stephanie, are you following us? Okay, good girl. So I hope everything is okay. And we mentioned what is the atrial fibrillation, what is the atrial flutter, and what is the gatekeeper, Rihanna. And the gatekeeper is of our benefits. And if we can get like also the premature, Irene, can be like bigeminy, if we have one normal followed by one abnormal, and we have trigeminy, Zara, if we have one or two normal, and the third one will be abnormal. And we talked about what is the difference in fibrillation and flutter, and how we judge about this issue. And in fibrillation, we have the ratio, which is like 2 to 1, 3 to 1, and so on. And in fibrillation, the P wave will be like having new name, which is F wave, because it is like fibrillation. It is not the same. It has no specific shape or character. I hope everyone done the exam, and I already watch your grade, except 2 or 3, and maybe they have exception, and I will talk with them about this issue. But so far, you did very good job, and your responses and your grade is okay, wonderful. And we will meet tomorrow at school 9:30 as we used, and we are going to practice. By the way, you have to know that every student has to submit to me 3 successful EKG. You made it by yourself. 3 successful EKG for different students. So you have to practice and take your precaution regarding ladies for making this EKG for your classmate. And tomorrow we'll start 9:30 and practice. And before practice, we are going to discuss what will be like re-entry, and that's it. Have a wonderful the rest of the day. Stay online till I get your attendance, please.